This video will explain how to do a PVR exam and a segmental pressure exam. Before you begin this exam, you will need to set up for it. First, you will select which transducer to use. 8 to 10 megahertz is the standard probe to use. If you have a patient that is bigger or really swollen, then you may choose to use a 4 megahertz transducer to get a better signal. You will need different size cuffs for this exam. So for a 3-cuff method, you will use a 17 centimeter cuff on the upper thigh and 2 10 centimeter cuffs below the knee, one on the calf and one on the ankle. For the 4-cuff method, you'll put 2 12 centimeter cuffs on the upper thigh, one on the upper thigh and one on the lower thigh, right above the knee, and then 2 10 centimeter cuffs below the knee on the calf and ankle. For both 3 and 4-cuff methods, you will need cuffs on the arm as well. You can also do metatarsal or foot cuffs and toe cuffs if you want to go more in depth, but these are optional. The cuffs should be put on snug, but where you can still slide your finger into them. Then you will connect the hoses to the cuffs. You can tell which hose goes to which cuff by matching the color on the hose to the color the machine tells you to use for that cuff. Make sure that the red hose is on the right and the yellow hose is on the left. Out of the 2 types of method, the 4-cuff method will be more beneficial because it gives you more information on the femoral artery. Instead of just knowing that the disease is in the thigh, like you would with the 3-cuff method, you will know that if it is in the upper thigh or if it is in the lower thigh. So a segmental pressure exam is a Doppler ultrasound exam that measures blood pressures in the legs to make sure that there is normal flow. By detecting differences in blood pressures at specific locations in different limbs, this test helps to diagnose arterial blockages and other circulation problems. It is normally done on people who are suspected to have PAD or peripheral artery disease who have leg pain with exercise. Ideally, before this exam begins, you will have a patient lay supine or on their back for about 15 minutes. To perform this exam, either the 3 or 4-cuff method can be used. You will inflate each cuff one by one. The cuff should be inflated until you can no longer hear the signal, and then you will go about 15 to 20 more millimeters of mercury as you go, recording the pressure that it gives you. If there is a drop in pressure between the 2 segments or the ratio is less than 1, then you know that there is disease in that segment. After doing this part of the exam, you will have the patient perform some toe-ups for approximately 3 minutes or until they can no longer do them, and then get pressures again. This is because the pressures can get worse with exercise. A PVR test is a pulse volume recording. It is basically a waveform analysis to look for arterial disease. The shape as well as the amplitude of the waveform are looked at in this exam. You can see how big the waveform is, or if it is monophasic, biphasic, or triphasic. To do this part of the exam, you will again want the patient to be laying supine with the same cuffs on their legs. The cuffs are inflated to 65 plus or minus 5 millimeters of mercury and then record the waveform. A PVR is interpreted by looking at the waveform. If you have a normal waveform in the thigh and an abnormal waveform in the calf, then you know the disease is in the femoral or popliteal segments. The difference between a segmental pressure exam And a PVR exam is that PVR uses the waveform to look for disease, while segmental pressure uses the blood pressures.